Welcome to this week's podcast. My guest this week is a naturopath, a lady who has been treating me for many years, who specialises in detox health, gut health, colonic irrigation therapy, and the author of Digestive Solutions, a book about 101 proven methods to solve your tummy problems naturally. Welcome, Michèle Wolff. How are you, Michelle, today?
Hi, Joe.
Thank you for taking the time. Michelle, tell us just briefly how you got to be in the wellness industry.
Yes, I'm originally from the UK and I trained as a nurse. And I went to Indonesia when I was very young and got very sick, ended up in an Indonesian hospital with a tropical parasite and salmonella. And when I got back to England, I realized the limits in medicine. So they're very good at surgery and crisis medicine, very good at pain, if you've got pain-killing drugs, but it was very limited in how it could treat me. So I first saw a Chinese medicine doctor who was my uncle. And then my brother came to me and said, somebody has come to work and talked about colonic hydrotherapy. So I did that. And in England, I embarked on diplomas in aromatherapy, hypnotherapy, reflexology. I trained in colonics, but they did not have a naturopathic degree. So I then came here to study that.
Well, you came to Australia because, we were advanced in that area, or just you happened to visit Australia, fell in love with it, thought, this is a great place to stay, and you studied here? Or what was the reasoning behind that?
So I originally visited to travel.
Yeah.
And then whilst I was traveling, I was working. So I went all over Australia, and then, I'd get odd jobs. And one of my employers with nursing offered me residency. And then I decided to go back to England because I'm the eldest of 7 children and I wasn't sure if I could, leave my family and so on. So I went back, studied a few things, but I wasn't fulfilled. They didn't at that time offer naturopathy. So they offered a degree in herbal medicine. They offered a degree in nutrition. Study was also double the price. It was double the price to live. And I decided to come back to Melbourne and do a 4-year degree in naturopathy, and then I ended up staying. So
yeah. Well, I'm glad you did, because you've been treating me for a long time now, and that's one of the reasons why I've got you on the podcast, because I'm always fascinated when I'm with you to hear the kind of things that you have to say. Your perspective on health and naturopathy and food and medicine is very interesting. So that's what we really want to talk about today. So, gut health is certainly a buzzword, that's been going around for the last couple of years. Tell us more about that. What's gut health in your mind?
So I think now modern research and doctors are agreeing with what naturopaths have been treating for years and years and years. Hippocrates was the father of ancient medicine and said the gut is the most important aspect of health, because it is all about your nutrition, so what you take in, and also what you excrete as far as toxic waste in your body. So not only does your gut affect itself and all your digestive organs, which include the liver, the pancreas, the gallbladder, the small intestine, large intestine, but it affects every other organ. So if you are not able to absorb and assimilate your nutrition properly, then it's going to have effect on other body parts as well. And if you can't excrete your toxins properly, then that's going to lead to problems. So in fact, a lot of illnesses are due to those two things.
Yeah, and a lot of people have only just sort of started realizing that the gut is very, very important. What do you think has made that happen in the last few years?
I think that gut problems have become way more prevalent because of our lifestyle, our diet, and therefore the research. So the medical profession have a lot of money to put into research, whereas our industry has less. So there's been a lot of really, really good research done, and even things like fecal bowel transfers and unusual things going on, and they've just discovered a lot about the gut microbiome, about the immune system. So the gut's 70% of the immune system, and a lot of the factors that affect the rest of the body. So probiotics have been researched more than ever before. So there just used to be, you know, a handful of main probiotics. Now, you know, they found well over 1,000 different species in the gut, and they're continuing to research
Yeah. Now,
that.
so let's assume. I mean, the people listening to this podcast are not all, you know, going to be experts on the gut. And I mean, I've learned a lot about it because I'm interested in myself. But you mentioned the word microbiome. Now, that's another word that's probably that's probably the biggest buzzword right now, is the microbiome. Can you tell us a little bit about that?
Yeah, so the microbiome is, you know, all the minute crevices and surfaces of the whole of the gut have a biome. So if you like, it's like lots and lots of bacteria, but healthy
Right.
bacteria. Similar to that, you have, you know, a whole range of microorganisms in soil. You
Yeah.
have a whole range of very healthy, they can be unhealthy as well,
Right.
species in the microbiome that play a lot of different factors in our health.
Yeah, so you know, we're discovering lately that that's very, very important, obviously. And how can we affect it? What can we do to ensure that we've got a healthy microbiome, or how do we know that we don't have a healthy microbiome?
Okay, so if you don't have a healthy microbiome, you can have all sorts of symptoms. I mean, you may have a disease, but there may just be everyday symptoms of moodiness, sluggishness, lethargy, constant colds, allergies, hay fever. I mean, these things that I'm talking about can have many different causes, but one cause can be the microbiome. So if it's out of balance, it can even obesity can be in part due to a poor microbiome, and you can get it. You really need to see somebody like myself to determine, you know, whether it's due to your microbiome or something else. You can actually get it tested now. So there are stool tests that tests obviously for, you know, parasites, candida, bacteria, and there are stool tests that test for microbiome. So to keep it healthy, if you don't have a particular problem, like if you don't need to be treated for a parasite or a bacteria, or you don't need to be on a special diet for a particular problem, if you eat over 40 different live foods per week, that helps a healthy microbiome. So I'm talking about whole plant foods, so vegetables, herbs and spices, fruit, nuts and seeds, you know, anything.
But how easy is it? That I mean, you know, you say, okay, you've got to eat 40 different, you know, varieties. But how easy is it really? Is that pragmatic to be able to do that? You know, is that easy? How can somebody do that? Because it sounds difficult, right?
Yeah. The thing is to start where you are. So if your diet is very simplistic and you just have, you know, one vegetable and a protein, you can gradually increase it. So I would never, I'd look at where somebody was. I'd never tell them the next week to have 40 different plant foods if they were very far away from it. So I take people in stages.
Gradually, yeah.
Yeah, gradually, and according to what they can realistically cope with, and I take into consideration their level of health as well. However, if you do a stir fry with lots of, and you put various herbs, and, you know, you put some oregano, some Italian herbs, some cumin, it's amazing, some garlic, some onion. It's amazing how actually it's not that when you look over the week, like for me, it wasn't as hard as I thought it was when I included a variety of different things. And then, you know, I do all these tests that I'm talking about on myself just to see, even though I may not be sick, but just as a level of where is my wellness and what do I have to improve on.
Yeah, I mean, because you've been teaching, I think you were teaching a course, Food is Medicine. Is that right?
Yeah, I taught on the naturopathic and nutrition degrees for 17 years, and one of the main subjects I taught was food as medicine. That's correct.
Yeah. So tell us more about that. I mean, because you know the whole adage, "You are what you eat." How true is that?
You are what you eat and what you are able to assimilate.
Right.
So your gut needs to have the capacity to absorb what you eat as well. So I might put people on different diets according to the strength of their digestion.
Right.
But yeah, your whole, your nutrition is affected as I mentioned, if your body has to cope with a lot of additives, preservatives, and processed food, then that becomes toxic. In a sense, sometimes you require more nutrition to process food that's devoid of nutrition, so it
Yeah.
can become
Right,
toxic. Yeah.
but shouldn't people be avoiding those foods to start off with? Okay, so let's look at what you do. Okay, so you're a naturopath and you specialize in in gut health. So typically, who comes to you and how do you treat them? Because this podcast is about informing people about things. I mean that I'm fascinated in, right? And I've got a whole lot of questions because there's a lot of things that I think there's a lot of myths, right? But we'll get to those in a minute. So tell us about, someone comes to you, who typically comes to see you and how do you then take them through the treatment?
Yeah, well, I treat a whole variety of things. Gut is what I specialize in, but
Yeah.
treat a whole variety of things. And typically people are referred by other people.
Right.
And it can be a range of people that come to me, but usually it's with a gut problem. It can be something very simple, like reflux or constipation. Well, when I say simple, it's simple for me to correct, or something very complex like Crohn's disease or inflammatory bowel disease, or sometimes I work with the medical profession with bowel cancer. So it can be a whole range of gut. And some people just might feel that they're really bloated and they don't know why, or really uncomfortable in their gut and they don't know why.
So, I mean, okay, so if I felt like that, most people would go to the doctor, right? So you go to the doctor can't treat it, or the doctor, suggests certain medications and it's still not working. That's why people come to you. Why do you think that people sort of, veer to the naturopaths apart from?
Yeah, so often they have tried a whole lot of things and they're not getting the results that they want. So, for example, somebody might come with chronic bloating and they've tried taking out a couple of foods and the doctor might have just given them a tablet to help, but it's not really helping. And I might discover they have small intestine bacterial overgrowth, or
SIBO, that's called SIBO, right?
SIBO, yeah. Or they might be intolerant to a certain food, or I discover that they have a parasite. So it's a lot of questioning by me and using my expertise to ask them a series of symptoms and how they feel to work it out. And I may back that up with a test. So sometimes I don't feel I need a test and I feel that the person may not have the money for the test, or sometimes I feel that the test is paramount and will really speed up the treatment.
Yeah. Okay. So we come to you, you do all these tests, and based on that, then you obviously give them, so supplements, herbal medicine, and so on, treatments to fix it up. The reason why I met you in the first place was because I came to have a colonic irrigation. Okay.
Yeah.
And I for me, it's wonderful. I really find I get a lot of benefit out of it. Talk us through that a bit, because people have heard about it. I've speak to friends about it, and you know what? A lot of people are like, oh, really? It's sort of in most, not most, but some people's minds, it's sort of, it freaks them out a bit, And I'm like, well, it's not that bad. Talk to us about that a bit, because I think that's very important. And how does that help people?
So colonic irrigation and colonic hydrotherapy are the same thing. And there are two main systems. There's a self-service system that you put yourself on, and then there's a closed system, which is what we do. So it's a little bit more comprehensive in what it does. It works with the bowel rather than against the bowel. It strengthens the muscle rather than weakens it. And what I like about it is there's a real duty of care with it, and people are usually highly trained at it. So you're with the person, or the practitioner is with the person all the time. The advantage of that is I can view what comes through the glass viewing tube. I can give abdominal massage.
Yeah, so let's take a step back, because I know what you're talking about, but someone who's listening to this doesn't know what is the difference between, and if you need to be specific, be specific. The difference between the closed method and the open method.
All right. So the open method, which is what I don't do,
Yeah.
You're lying on a bed and it's got a hole in it. It's a bit like a toilet in the middle of the bed.
Yeah.
you put a small tube into, there's no practitioner in the room.
Yeah.
You put a small tube into about the size of a pencil.
Yeah.
And then the machine's switched on, the practitioner walks out. I mean, they can have 4 or 5 of these machines and just one person running it, like on reception, a bit like the sunbed lounge sort of thing.
Yeah.
And then water goes into your bowel, but at the same pressure all the time. And then when you need to go to the toilet, you push around this tube that's in you and you go into the toilet. Now, look, for
so it's a release, right? So it fills you up, right? Yes. And then naturally you feel like you need to release.
Yeah, like you're going to the toilet. Right. So for some people that works well, but if you've got a problem in it, so if you're a bit tense or for some reason your bowel's tense, the water can just fill up and fill up and fill up and it not release properly, so it can overstretch the bowel. It's with the closed system, there's very little risk. With the open system, because you haven't got anybody there, they're the only systems that where there have been.
Yeah. So describe to us the closed method.
Yeah. So the closed system is a lot more detailed in what it does. So you're lying on the massage, but you're covered up, by the way, all the time. It's very simplified, as you know. The tube that goes in you is a bit larger, but it's got a guide, so it goes in with lots of lubrication and only about that far. And then attached to that is disposable tubing, which attaches to a glass viewing tube in the machine. And there's an inlet pipe, and so the clean water doesn't meet the dirty water. Yeah. So the practitioner can see on the machine when your bowel wants to push, when there's an air pocket, when it's meeting a stool, basically by pressure. So they know when to fill and release, and by doing that, it just works a lot easier with the bowel muscle. They can see when it may be advantageous to do a bit of abdominal massage. They can change temperature. It's more detailed, but it's not as lucrative for the practitioner as the other method. That's why there's not as many of them, around. I just feel it's much more holistic. I can talk to the person about what's going on with their health, and then I can offer other things I do. Like, for example, we have seen people who've had lots of the other system, which, as I said, might be great for some conditions and some people, but they haven't realized that they've got a parasite that's needed to be treated, or they've got a food intolerance, or that the reason they've got chronic constipation has been due to a dietary factor. So I can correct that, and then the health goes. So colonics is one aspect. Yeah.
Okay. So I've had both. Okay. I've had mainly the closed method, when I come and see you, and I've had it in other parts of the world, but I've also had the open method. And personally, hands down, the closed method is the best for various reasons. So just to let the listeners know, so your closed method, you have the tube inserted in you, you got water put up, it releases, and it goes into the machine. And this is what's fascinating to me. I mean, it might sound strange, but you can actually see your stools coming out. Now, when you see them coming out, what are the things that you can tell, and how can you tell? And be specific, because that's what this is about. It's we want to get to the nuts and bolts of it, so to speak.
Yeah. So I'll tell you in a sec what I can see, but just to say that some things I will need to get people to send a stool sample to a lab. So I can't see tiny bacteria and tiny parasites that need to be seen under a microscope. But I know from somebody's symptoms if they need that test. But what I can see is how well people are digesting food. So often, if their food is not well chewed, or they don't have good amounts of digestive juices to break it down, I can see food particles. Can often tell what that is. Oh, you've eaten mushrooms last night, or
so you can see that. I mean, I've been able to see it, but I've been at a distance. So you're obviously closer to the window where you can see the stool. So what do you see?
Well, it just looks like that food, but in a small way. So you'll see the stools, and because it's watered down, it sort of separates. You can see the types of food. I mean,
Yeah.
I can't see if somebody's had a chocolate cake, but I certainly can see, nuts, seeds, different vegetables,
Yeah.
and so on. You can see mucus, which causes inflammation, or it may be because somebody's overdone a mucus forming food like
Yeah.
dairy or wheat. You can see candida if it's prolific. You can see
So how do you know it's candida? What do you actually see that
it
tells
looks
you?
like fluffy cotton wool,
Right.
and the older it is, the darker it is. So it will be like a dark yellow if it's been there for a while, or it'll be like a brighter white color. And you can see how well if the stool's quite fatty, that's often poor liver metabolism or poor bile flow, because they haven't been able to break down the fat adequately. You can see if they're producing enough digestive enzymes by the way that the food is broken down. And quite often I'll back it by asking other questions as well. So, you just get to know what a healthy stool and unhealthy. However, you could have your first colonic and it looks fairly healthy, and then your second and third colonic, because it's like soaking clay off a pipe, you get deeper into the bowel wall and you get much more yucky stuff coming out. So
right, because
not
the digestive tract has got an amazing way, or the human body's got an amazing way of compacting certain material that we ingest that can't be broken down, right? So some of the stools that you see, or when you start to really clean, how do you know how long have they been in there for? Could it be for years or months? Tell us about that, because that fascinates me. I mean, I think that to try and understand your health, you really need to see what's inside you and what you're, eliminating, or how well you're eliminating, and that's what this does, right?
Yeah, so your stools are not like, if you look at a tree, you can tell by the rings that this is 1 year, 2 year, 3 year. It's not quite as accurate as that. But some of the stools come out with markings of the bowel wall, a bit like a fossil,
So you actually see, I've actually seen that myself,
So that's been there usually for some time. Sometimes you can tell by the color. I mean, if fresh food is coming out, that's from the last week. And then sometimes you can see older stuff coming out by the consistency or those markings. One thing that I did see come out, which was very unusual, was years ago, like a little silver button came out of a guy, and I said to him, wow, do you know how that got there? And he talked to his mum, and she said when he was 4 years old, he had swallowed some of her silver buttons when she was sewing.
Right.
And look, when I worked in casualty and kids swallowed things, most of the time they would come out. However, your bowel has a lot of crevices and turns, and that had just got stuck somewhere, and it just needed the colonic.
Right. So how old was this guy, roughly? How old?
He was in his 40s, and he had swallowed that when he was 4.
So essentially, this button had been inside him for the better part of 40 plus years.
Yeah. Now, as I say, it's quite unusual, because usually, eventually, things will come out. But I suspect it just got, you've got two sides where the bowel turns. It had just got stuck in a crevice.
That's amazing. What other thing I was going to ask you, that one of the questions was, what's the weirdest thing you've seen? I mean, okay, the button, is there anything weirder than that you've seen?
For me now, nothing much is weird, but for the public that might sound weird. I've seen a tapeworm that was as long as the tube.
Wow.
Yeah, so that's and I've seen worms are often bigger than parasites. You can't necessarily see parasites, but you can determine, or I can determine, that they are there from talking to people or getting a test. But worms can. That's unusual. I've been in the industry for over 30 years, and I've just done a tapeworm once. But yes, that it's people have all sorts of pathology.
Is that because tapeworms are rare, or it's just that they're not visible? normally? Because obviously, we've all heard about tapeworms. We've had it when we were kids and so on. So how do we know that we've got tapeworms? Because you
Oh,
see it.
usually you'd be very sick and have bowel symptoms, and
Yeah,
usually
right.
if I want a worm test, I'll request that the lab does a worm as well as it's a separate test. They
Yeah,
test
right.
a variety of worms. This person had lived overseas in unhygienic conditions, but you can get it from raw meat and raw fish. But normally, if you've got a healthy upper gut, your hydrochloric acid will kill off like a worm egg or the beginning of it, so it won't develop. The other thing is when you're doing a treatment like colonics or another treatment, because tapeworms are quite big, they can just go up, and sometimes they can get into the small intestine and then come back down again. So they can run away.
Yeah, right. And that's an important point you make, because when you actually have a colonic hydrotherapy, the water goes in and it's not going into the small intestine, right? It's only just mainly cleaning the large intestine.
Yeah. So you've got 5.5 foot of large intestine, and there's a valve called the ileocecal valve, which shuts off. It only allows things one way. Usually, unless there's a problem. And your small intestine comes from your stomach, and it's 22 feet, and that's where most of your food is a liquid, and it breaks down. A lot of your absorption takes place. Your large intestine, your stool becomes solid.
Yeah, and I got a couple more questions, because I want to move on to some other stuff, which is really fascinating to me as well, in terms of the myths about food and so on. So a couple more things about colonics before we move on. So typically, how many do people, if someone's thinking about it, right? How many do they sort of need to have? How often do they need to do it?
It depends. So some people come just for a general cleanse and they're really healthy, and some people come to help resolve a particular problem. So usually it would be a minimum of 3 treatments, a maximum of 10 treatments, according to what they're trying to resolve and their level of health. I'm about doing it holistically, so if I can see other ways to heal them faster so that they don't have to have as many colonics, I will use that. But if you just have one treatment, it will have an effect, but it's just starting a process. It's like if you went to see a chiropractor, you wouldn't normally just have one treatment. You need to follow up with several to get an effect.
Yeah, and the treatment normally lasts for about 40 minutes, right? Just so people know, 45 minutes.
About 45 minutes. You're usually here for an hour to allow for changing, going to the toilet, having a probiotic drink.
Right. And one more thing before we move on. One thing that fascinated me about when I used to see Rochelle, so she's retired now. But one thing that she told me one day when I was having it done was that some people, I mean, not only just cleanses them like physically in terms of releasing stools, but some people actually find that they releasing emotions. They
most definitely.
So tell us, how does that happen? What's the gut? Your large intestine's getting filled with water. How does that make you cry? Because some people can cry, right? Some people can really get emotional. And explain that to us.
So I think most people know now that we are emotional, spiritual, and physical beings.
Yeah.
So that if you see something scary on a movie, you can feel it in your gut. Most people have had an experience where they felt some emotional reaction in their gut.
Yeah.
And emotions can store in all sorts of places in your body. So somebody can get a headache or a backache from emotional stress, but equally a lot is stored in the gut. And I think if most of us tune in to life experiences, I know when I was little and I went for exams, it would affect my gut so much I would have diarrhea. So if you've had a lot of stress, it definitely can store in the gut, and you can hold on to things as a protection. But when you're having the colonics, you don't have that control, so it can release things. And we've had several people that they've been lying back, and then they might suddenly start talking about something that happened years and years ago, and then they have a release with that, or they will be quite calm, and then start crying, or they'll report that when they went home, they had a cry for a couple of days and then felt really good. So it's not something to be afraid of because it's a positive release.
Yeah.
And some people can just feel a release spiritually, like they become a nicer a person and a calmer person. It definitely affects the mind and the emotions as well as physically.
Yeah, well, I guess, a lot of people go, I've got a gut feeling about this situation.
Yeah.
I've got a gut feeling about this person. And it's interesting that we've always sort of used that terminology, but when you actually start to analyze it, it's true. So I want to talk about a few other things now, because one thing that fascinates me talking to people, as you know, I've got a food science background. I've been sort of researching and I've been coming to you for years, probably the better part of 8, 9 years. And being seeing other therapists for other various things in terms of the physical body, because I'm really fascinated by it. What fascinates me is the myths. There's a lot of myths, isn't there, out there? Like one thing that interests me is when someone has got to run to the toilet and they've just eaten something and they've got to run to the toilet and they're like, oh, that must have been those eggs. They've just gone right through me. Is that true or not?
If you have a severe allergic reaction to something, yes, but it won't be. So say you're eating those eggs and you run to the toilet, it won't be those eggs that are coming out, because
No.
it takes a process usually of at least 24 hours to come
Exactly.
through.
Yeah.
But if you have a severe allergy to them, or like so some people can eat things and they will blow up, or they'll get an itchy throat.
Yeah.
That's an immediate reaction, but it's rare. It's rare that what you eat immediately causes diarrhea. It's
Yeah.
usually it's more likely that it's something they ate the day before.
Yeah.
More likely.
So what is actually, you talked about, so you eat something that normally takes about 24 hours. What is the frequency that someone should really be going to the bathroom? Should you be going every day? I mean, what you must see a variety of sort of situations. What's normal and what's not normal that, some people think it's normal, but they should actually be seeking help.
If you're eating three meals a day,
Yeah.
then yes, ideally you want to have between 24 and 48 hours max cycle. So when you're having breakfast one day, after breakfast the next day, you want that to come out.
Yeah.
And then, but the amount of stool you're passing is also important. So some people tell me they're going to the toilet every day, but it can be that much. So ideally, you want from your wrist to your elbow, that length. It might be I'm being a bit graphic here. It might be in several bits, but about that much stool if you're having 3 meals a day, and about the width of a sausage, and to be a healthy brown color, and you don't want to see any food particles in it. Ideally, that's a healthy.
Yeah, right.
Yes, and it's if you're only going to the toilet every second day, or sometimes I see people only going once a week, that's constipation. That causes problems.
But that obvious, but some people think that's normal, right? That's what I wanted to discuss here. That is not normal. If you're, going to the toilet only once a week, you should be seeking help.
Oh, most definitely. And usually you're really uncomfortable because all the food there is like sitting in your waste pit and fermenting, and it can set you up for problems long term. For a healthy bowel and your health overall, you want to be eliminating every day.
Yeah, right. So, and there's another buzzword that people are starting to talk about now, called leaky gut. What's leaky gut?
So leaky gut can be caused by a variety of things. It can be food intolerances, stress, alcohol, mineral deficiencies, pathology in the bowel, antibiotics, and so on. There's various things that can cause it. So at the side of your bowel wall, it's slightly porous. So if you think of a stocking, it's got holes in it. It allows things to go through, and it allows things not to come backward. So we want the digestive food particles to go through that. But with a leaky gut, there's too much pressure. Those little holes get a bit bigger, and food molecules go through which shouldn't. Often it starts off often with inflammation on the side of the bowel wall as well. And then what happens is it's called a antibody antigen response. So if a food molecule goes through the bowel, then the body says, hey, there's a poison here, we don't recognize that,
Yeah.
and it will form what we call an antigen antibody response, and then can set up an intolerance. So basically, you've got things that are leaking from the bowel into the bloodstream that shouldn't be. And you know, your gut is 200 times the surface of your skin, and it's also main site for environmental toxins, and that can contribute to leaky gut as well.
Yeah, right. And you know, speaking about toxins and so on, I think you said once, or we chatted about it. There was what 84,000 registered chemicals in Australia. Is that right?
That's
Across.
right. Yeah, I mean, that's not just industrial chemicals, but chemicals in makeup, food. You know, your house is more. None of these toxins were around when my grandparents, who aren't alive now, but when they were young.
Yeah.
So we have to cope with a lot from what's in our house, what's in our food, what's in the environment, what we're breathing in. And therefore, I feel that's one reason why people benefit from detoxifying.
Yeah, right. And you touched on a point there. These things weren't around when your grandparents were alive. Why is it? This one fascinates me, and I hope it fascinates some of the listeners as well. So today, if you've got a kid, the kid goes to school. They're not allowed to have any products with peanuts. You know, the cakes aren't allowed to have peanuts, and so. Okay, I'm 47. I was at school 42 years ago. I was in primary school. You know, 40 years ago. 40 years ago, we didn't have that issue. So why, between 40 years ago and today, why do kids have peanut allergies? How did that happen? Why didn't we have it when I was a kid and now we do?
I think there is a whole range of things that contribute to that, and it's still being researched. So each generation, so when you're a baby in your mother's womb, you have more toxins to cope with to start with there.
Yeah.
So there's a man called Professor Mark Cohen at Monash who's done a lot of studies on cord blood, and it usually finds well over 100 toxins. So that's one start. The other.
So as soon as you're born, when you're born, you pretty much you're already started behind the 8 ball. You've got 100 toxins. Yeah.
Fire retardants, heavy metals, all sorts of things.
Yeah.
Then it's the health of your microbiome. So whether you're cesarean born, vaginal born, whether you breastfeed, all of these things contribute to the build-up of the child's immunity. Then it's the environment that you're brought up in, both what you're breathing in and what you're eating. And then there's things like drugs. So children, and not just children, but everybody consume more medication than they used to. Then there's a real quandary around the amount of vaccinations that children have and the adjuvants in that. I'm not against vaccinations, but what has happened is that there's far more of them and far more adjuvants, and children are having them younger. That can be a contributing factor as well. So it can be a whole range of things that affect the immune system and that are making children weaker. And diet is very, very different from what it used to be. I've seen young children 4 years old never having used a knife and fork. They just pick up hamburgers and chips, and I've seen children not being able to recognize common vegetables. So it's very, very different. Yeah.
I mean, so that really what that's telling us, in the 40 years, since when I came into this world in 1974, from then till now, there's been a significant impact on children because of all these elements that you've just described. So, but why peanuts? Why isn't it bananas? Or why isn't it, I don't know, some other food that, kids will eat? Why isn't it a tomato?
There are certain chemicals in different foods that can make them more allergic or not. So there's like a peanut is much harder to digest because of its makeup of its chemical constitution than other nuts, for example. And you'll find in foods as general. So the most common allergies I see to foods are dairy, wheat, sugar, certain nuts, but you can be allergic to tomatoes and other things. Maybe genetically, we're getting weaker genetically, and then it's a combination of these other things. And definitely the gut microbiome has some involvement too. The immune system has got very confused with some people to attack something that is healthy.
And so, what do you think is next? What might we be allergic to in 30 or 40 years? From what you know, from what you're studying, from what you're researching, what do you think is we need to worry about in the future?
Well, look, on the one hand, the way the food industry is going, and environment and drug therapy, etc., it could get worse. But on the other hand, what I get very excited about with my job is there's also the opposite available. So I can educate people on environmental toxic, what they can do in their day-to-day life with food as well. So just as there's the processed food industry, and just as people don't have whole food, there's also the organic industry, and there's also more abundance now of food around. I remember back in the day when I would diagnose somebody with celiac with a test, it was very, very hard for them to get gluten-free products. Now they're abundant. So I think we can go both ways, and part of my job is educating people how they can get to optimal health, because it's possible, and it's possible also with the food and supplements and your lifestyle, how you can live. Something that I've implemented into my clinic, I completed a qualification in Ayurvedic medicine in lockdown, and that has a very deep method of detoxifying, but also lifestyle medicine. So who knows look, over the last 20 years, we've developed more and more autoimmune illnesses, more and more diabetes, more and more obesity. So all of that, and more cancers, that can get worse. But you can take the other path and you can get better. And that's what I'm excited about preventing those things and helping.
Well, that concludes the first part of my chat with Michèle Wolff. Stay tuned next week, where Michèle continues to discuss the reasons why certain foods have an effect on humans. She also takes us through the reasons why she went from being a vegan to now including meats in her diet, why do beans give you gas, and why some doctors don't like naturopaths. For the time being, we hope you enjoyed the first part of my chat with Michèle, and if you'd like it, don't forget to share it with your friends. Ciao for now.